These are my disclosures. Importantly, I have received some funds for speaking and for research purposes from Allergan. So this is a systematic review we conducted on adverse events with Botox and Dysport for a group of patients with refractory overactive bladder. So as we both know, the two commonly used preparations of botulinum toxin A are botulinum toxin A manufactured by Allergan and botulinum toxin A manufactured by Dysport. Botox obviously has the license now, but there are some generic differences in the properties of the two compounds, in particular the molecular size, the protein content, and therefore potentially the antigenicity, the way it's manufactured, and importantly, the dosing is different between the two formulations. So we feel that 1 unit of Botox is probably equivalent to 2 to 3 units of Dysport. So our objective, this really came about from a meeting that Chris Chappell and I were at, and we were interested actually to know if there was a difference in distal muscle weakness seen between the compounds, because we had an inkling from the literature that might be the case. This kind of snowballed into a sort of much bigger systematic review of all adverse events. So, like I said, we conducted quite a robust systematic review. We searched PubMed, Embase, Cochrane databases from inception till December 14. We screened approximately 4,000 abstracts between 2 independent reviewers, and then we whittled that down with the exclusion criteria to 107 studies which were included in the analysis. We particularly focused on adults, so no pediatric population was analyzed, and we looked specifically for overactive bladder. So that was refractory, either an idiopathic or neurogenic. The main outcome was to assess adverse events, as Chris's group had already looked at efficacy in a recent publication. So this is the summary of the results. In general, when we looked at pain, UTIs, hematuria, those kind of side effects, we found there weren't much differences between the two compounds. However, with generalized muscle weakness, although we didn't see anything statistically different between the individual subpopulations, i.e. idiopathic or neurogenic, when the data was pooled, there was a statistically significant difference with more weakness seen in the Dysport. At present, actually, we're now redoing some analysis to look at dose, and clearly dose is relevant here, and we're awaiting that statistical analysis at the moment. The other thing of interest was the raised PVR and de novo CISC group, specifically in the idiopathic population here. And we did see increase or statistically significant increase in this with the Botox group compared to Dysport. However, I must point out, when we looked at all the data, the number of studies with Botox far excess those with Dysport, and the problem is it's such a heterogeneous population, and we had lots of different cutoff values for instigating CISC, different people calling residual significant depending on different cutoffs. It could have been 100, 150, 200, and so forth, which kind of made it difficult to particularly analyze this group with any certainty. So in conclusion, ladies and gentlemen, the adverse event profiles between the two compounds are relatively similar. We are doing some further work on the generalized muscle weakness to look at dose, but we did find an increased weakness with Dysport in the pooled analysis. And like I said, the results regarding CISC are difficult to interpret at this stage. Thank you.
Questions? You did not find through your readings that muscle weakness was underreported? It's not your feeling, it's been my feeling. Personally, I think that we have much more. The problem is we don't see them because they are seen by physiatrists or they are seen by different other physicians, and we don't see these patients when they have muscle weakness. And very often they don't report when they come back. It's not your feeling?
I personally been using one of the compounds for 11 years. I've never seen it, but it's definitely reported out in the literature. There's several publications, both with Dysport and Botox now. In the beginning, there was quite a few publications in Dysport, more than Botox, and that's why I was just interested to know if it was something in the compounds that made that more apparent. But actually now we see some Botox distal muscle weakness definitely linked to dose, because in the Dysport papers, it's the 1,000 and 750 unit doses that were giving the weaknesses. I don't believe, although there may be one case with 500.
Yes, Ivo.
There have been a few reports of just injecting the trigone with botulinum toxin and there not being so much in the way of retention when you do that. Dysport has very few papers compared to Botox. And I was wondering, did you control for that? Because that could make the difference in your data on the retention.
We do have that data. We haven't looked at the analysis by variation in technique. That's a fair point. But I can tell you that the vast majority of the studies in the analysis were non-trigonal.
Catherine?
Thank you. Did you look at all at the quality of the studies? More and more systematic reviews really require us to think carefully about that. And I would imagine overall, when it comes to things like blinding, sample size, type of study, et cetera, that some of these may not be of particularly high quality. So I wonder how that could potentially influence your conclusions.
I totally agree. I think that in general, the quality was lower than we anticipated. This analysis I'm showing you now is a pooled analysis of RCTs, so level 1 evidence, but with, in addition, observational studies. So as part of our reanalysis, which we're, like I mentioned, we're doing some things, some tweaking of the data, we're also looking at the stats separate. So pooled, as I've shown, but also looking at just the level 1 evidence and just the observational study evidence, which is obviously quite different.
But you can have an RCT that's very poorly blinded and otherwise done, so it may be quote-unquote level 1, but the quality is so poor, you really still can't make good conclusions from it.
Yeah, I agree.
No more questions? Thank you very much.